is now starting. All attendees are in listen-only mode.
Hello, this is Dr. Richard Barwell. Welcome back to Marketing Brain Health Part 2. We're going to start out with a little review, and then we'll get into the new material. So let's just sort of go back one step here, if it'll let me. And it's not letting me go back. I think we'll have to, there we go. It's computers, aren't they lovely? So brain and health. The brain is a central organizing authority, integrates all the systems of the body. Remember, we talked about that. That's where we need to be focused as chiropractors. Disruption of brain function manifests as illness and disease. And that's something that we need to keep at the foreground of our approach in chiropractic. The disruption of brain function and illness. It doesn't mean we treat disease and illness. We need to be taking a look at brain function, and our job needs to be normalizing brain function. There is so much research out there that supports how stress affects the central nervous system, that 95% of all diseases and illnesses are caused by stress. We know that this is a fact. This has been known since the 1950s, the role of stress plays in it. And it's an area that we should have been focused on, seeing that part of our dialogue in chiropractic is that stress is the cause of vertebral subluxation. So we should have been addressing the stressors rather than the result of the stressors being vertebral subluxation. So the role of pain. Pain is created by the brain to let the conscious mind know that there is a problem. It includes all other signs and symptoms. So every sign and symptom we have is strictly where the brain is saying, letting the conscious mind know we've got a problem. It's been manifesting and doing what it can with all that illness or that stress on the central nervous system until finally we start to get some malfunction. But when it reaches a point where that it can no longer deal with it, it has to inform the conscious mind. So the goal of care has to be greater than simply addressing a pain or a sign or a symptom. It has to start addressing the cause of the problem. And that's where we come in. Nobody else can do what we do. The gap trap. The profession has built its position on healthcare based on back pain. Good grief. I mean, that's what we narrowed ourselves down to, is taking care of back pain. Patients are now well trained to only seek care after symptoms have developed. The medical profession has been training them for a long time, saying, what's your symptoms? If you went to see a medical doctor and didn't have any symptoms, they kick you out because you're wasting their time. But there's more to it than that. As the chiropractors continue to talk about spines and back pain and bones, the public will continue to think that that's our place in healthcare. We're creating our own problem, and we need to change our dialogue with the patients to get them to understand that we have something greater of value than just taking care of their signs or their symptoms. Showing a patient spinal x-rays or a dry spine just supports their mindset. It doesn't mean that there isn't value in x-rays or a dry spine to show damage or degeneration, but there's more to it than that. And if that's where you're limiting your education, that's the response level you're going to get out of the patient. So the gap trap, again, you have to bridge the gap between back speak and brain involvement. That's where chiropractors go into a panic when I start talking about neurologically based chiropractic. How do I do this? What do I say to my patient? How do I change them over to brain? Today, there's lots of this and neuro that, and there's neuro techniques and neuro practice management programs. There's neuro posters all over the place. It's now sprung up. I've been 20 years working at moving this profession towards a neurologically based chiropractic. And so it's catching on, but unfortunately it catches on without any meat to support it. The truth of the matter is, without an objective method of measuring for pre and post care, it's just talk. It's just talk. If you're using leg lengths to determine neural problems in somebody's, that's great. It's not a question of whether that works or not. It's a question of what do you have that's going to objectively show that there's a neurological change going on. Other than that, it's just talk, and it won't have any more weight than anything we've done in the past. Important considerations when marketing brain health. And Accurate brain assessments. Today, that's where I'm going to focus the rest of this talk. But as of next time, it'll be talking about age influence and appropriate retraining. After that, we're going to talk about complementary procedures, all based on marketing brain health, and then reassessment and how we discuss those and how we incorporate those into our practice. So accurate brain assessments. The shift from orthopedic testing for joint function to neurological function calls for new methods of testing. You can't do orthopedic testing and use that as your neurological foundation. We have to move it up. And this includes things like history of trauma, a mental status, sleep programs, whether you've had traumatic brain injuries or not. Those are all questions that need to be asked, very, very importantly asked up front. Motor and sensory testings, coordination, gait, eye movements. And the top of the line is EEG, actually taking a look at what's going on. Not every office can have a functional MRI in their office. And so when we can finally get around to affording that, that would be great. But right now we have EEG and the stress recovery testing. We can actually take a look at what stress does to the brain during the stress times and its ability to recover in both cortical patterns and limbic system responses. So neurophysiologically activity measurements, what can we use? Cortical activity, brainwave frequencies, EEG, synaptic brain patterns, 99% reproducible. We've seen this time after time. People come in, they get tested, we look at their EEG, we make suggestions, we see them 2 years later, they want to be tested again, and we ask them, what did you do? Did you follow our instructions? No, I didn't do anything. I mean, why do they want to come and get tested? Drives us crazy if they're not willing to listen. We can do the pattern and we'll see it's exactly the same. So we can really depend on things like EEGs. They're around, they've been around a long time, and they really tell us about what the hardwired patterns that make that individual up are. Those are patterns that develop through genetic patterning and experiences that the brain remembers and builds a wiring pattern for it. And then we have the limbic responses, because the limbic responses can connect with the cortical activity. They talk back and forth to one another to say, have I seen this before? I don't know, let's find out. Go and check the memory pattern and say, yes, I remember a dog that bit me, it looked just like that. And now the limbic system kicks into gear with the autonomics. So we need to look at the autonomics. Heart rate should be 56 to 66 beats a minute while they're sitting relaxed in a chair. Respiration should be 6 to 12 breaths a minute with an adult. Heart rate variability. Heart rate variability is a study unto itself. It really gives us a good idea of the effect of stress on the sympathetic, parasympathetic balance in cardiovascular function. It also includes respiration, heart rate, and how the patterns of how they're breathing. And we can see what's going on with that heart rate and their cardiovascular responses, but also whether they're stuck in fight, flight, or whether they can get themselves out of fight, flight. Sweat glands, that's in the hands. It should be 0.8 to 1.5. And you should develop more moisture in your hands during stress and less and when you're recovering. It should go up and down and vary. Thermal activity, extremities. We know that the extremity temperature should be 93.9 to 96.9 in the hands. We can tell whether it's under sympathetic control because during sympathetic activity, the hand temperatures would drop, sweat glands would increase, respiration should go up, heart rate should go up. When you close your eyes and relax, that should reverse. That's the ideal state, and we can see whether or not that's doing it. SEMGs, we have been talking about paraspinal SEMGs for a long time. There's lots of instruments out there to measure that. But we wanted to look more at the stress response and the stress effect. So we look at the traps to see whether or not you go into fight, flight, defense mode by tightening the traps. But also with the traps, we want to see if you're an upper respiratory breather. Because if you're an upper respiratory breather, we're going to have trouble with heart rate variability. And you have to look at all of these things. You've got to look at SEMG, heart rate, respiration rate if you really want to understand heart rate variability. Just looking at heart rate variability alone doesn't give you the whole picture. Also, you can do blood pressure, but you should do it bilaterally. Bilateral weight scales, posture. Posture is a picture of your neurological dyskinesis. So these are all things that we can now start using as a guide for the measurement of the effectiveness of your care to change the neurological patterns of the patient, not just at the autonomic nervous system level, but also at the cortical level that's driving the autonomic nervous system level. If you don't change the cortical level, the pattern will come back. And so that's what's important. And we find that people that stay under long-term care, the reason that we get better results from them and see bigger changes with it is because that repetition of care starts to change EEG patterns. We now have justification for care beyond symptom relief, because the intent of the care now is about taking care of neurological responses. Dynamic assessment. Patterns of cortical activity are formed through genetic expression, about 20%, and through learned experiences. About 80% of who you are is through your learned experiences, hardwired into the cortex to help guide you through safety and survival as we live through this world. Beta frequencies in the cortical pattern, it's the wide awake and alert consciousness. It's the defense. There's no healing when you're stuck in beta. Beta is there to warn you what's going on. Then the next level down is called alpha frequency. That's why you're awake, but you're relaxed and you're in meditation. Healing begins in alpha. The next level shift down is theta, and that's when you move down into the subconscious. That's light sleep, rapid eye movement, dream sleep. And at theta, we're now starting to talk with the majority of the brain function. Alpha and beta frequencies only represent 5% of brain function. Okay? Consciousness is only 5%. The subconscious is 95% that we have never been able to look at before in chiropractic. And now we can start to really take a look at what's driving these people, these patients that come in, where the issues are from a subconscious level. Then we look at things like delta, which is deep sleep growth, and that's the maximum healing level. Delta is coma state, basically. That's the deep sleep state. The reason they put people into delta in the hospital, in a coma in a hospital, so all that neurological energy can go towards growth and healing. Awake, relaxed state, the ideal percentages are beta should be about 30%, alpha should be 22%, theta should be at 20%, delta should be at 5%, and they should change as you go through stress and recovery. The ratios of different brain frequencies offer an insight into the state of the brain as to what D.D. Palmer talked about as tone. Nothing is new, it just comes around with better understanding. The brain activity can be over-aroused, under-aroused, unstable, or exhausted. The ability for the brain to engage and disengage from these frequencies during the time of stress and recovery are critical for good neurological health. You have to be able to adapt and respond and recover. Brain responds to different stressors with learned patterns. You've already learned patterns that are well established, and you get stuck in those patterns because the brain cannot self-regulate. It's important to address the brain's responses to cognitive, emotional, and physical stressors. Does that sound familiar? Those are the foundations for the creation of vertebral subluxation. It starts in the brain and ends up in the muscles, which distort the bone, and we end up with vertebral problems. Yes, vertebral subluxation exists, but exists as our gateway to change the patterns within the brain. The ability of the brain to recover from stressors is more important than the stress response itself, because we're not recovering, we're getting overwhelmed. Neuroinfiniti instrument measures the brain reactions to stressors and its ability to recover. That's why we developed it. We realized that we were onto something big, but we had nothing at our disposal to be able to bring to a chiropractic office to be able to actually measure the changes that we were creating in people's central nervous system function. The instrument is FDA, CE, ISO, and Health Canada certified. That's important. There's other instruments out there that are not certified. Do not get involved with them. It's a problem. We need to stay above board within our profession. The stress response evaluation takes 15 minutes to do. It's a computerized test. It provides information on both cortical activity and responses, sympathetic and parasympathetic patterns. Without this information, if you're marketing brain health, you need to know that there are products out there that you can be using in your office to truly establish your neurological function. Once again, My book, if you need to get a copy of my book, and I highly recommend it because it goes into great depth with this. And not only that, it's written for patients. Just let us know, get in touch with Dee Dee, and she'll tell you about the book. You can buy it by the case at a much less price than a single, and we can get it out to you very quickly. So that's it for today, and we'll talk to you next week. I hope you enjoyed this. Let us know.